Runny nose and cough are major symptoms of common cold, especially during the raining season. Today on Sound Health, our focus is on managing upper respiratory tract infection. I'm Olasumbo Modupe. Thanks for staying tuned. Okay, thanks for staying with us. This week on Sound Health, we are looking at upper respiratory tract infection, and Dr. Vincent Abimbola, consultant ear, nose and throat surgeon, will diagnose and treat upper respiratory tract infections, the different types of upper respiratory tract infection. Welcome to the show, doctor.
Thank you for having me.
Okay, to start with, what is upper respiratory tract infection?
Well, let us start with a very simple way of approach. We have upper airway, we have lower airway. The upper airway is from the middle third of the face, where we have the nose down to the middle part of the neck. That's the upper airway. Now, the lower airway is from the middle of the neck down to the chest there. And we have many structures in these areas. We are more concerned with the upper airway, with the topic she introduced. Now, in the upper airway, we have the nose. We have some structure within the nose. We call it the nasal cavity. We have adjacent area to the nose. We call it sinuses. We have the back of the nose, which is the throat. Actually, throat has three parts. One part behind the nose, one part behind the mouth, and one part lower down. That's the part of the throat. And again, we have, well, in this area we have different structures. Maybe as we are talking along, we'll be able to understand more and more. Now you have to talk about the infections in this area. We talk about the infection of the nose, of the sinuses, which is the empty space within the skull, within the head. There's the bone splits open where we have some air, and it has some function like making our head very light, in phonation and other things. Now these are the sinus. They can be infected because the nose lining and that of the sinus lining is the same. As somebody have an infection in the nose, it can spread to those sinuses, and again from the nose again it can go to the ear. There's a tube linking the nose and the back of the nose to the ear. A child may have infection in the nose, which affects the ear. Likewise, you can have an infection like this sinus I'm talking about now. When they have infection, the mucus inside them, the infected mucus, can be trickling down to the back of the nose, infecting the structures as it's going down, giving you pharyngitis, laryngitis, so many,
Okay. So how long does upper respiratory tract infections last?
Well, if we talk about infection, we want to look at whether you are talking about viral infection, bacterial infection, fungal. So these are the infections that can affect, people talk about, we talk about common cold, we talk about common cold, which may be due to some viral condition, which is most of the time is self-limiting. Okay. Self-limiting. Okay. and within 2 weeks, within 7 days to 2 weeks, it subsides, furtherly. Then if it progresses, you may have to now see an ENT doctor to treat.
Okay. During this episode, we're trying to look at the common respiratory tract infections. We are looking at cold, which is also known as catarrh or flu. We are looking at cough and sore throat. So to start with, let's look at flu, popularly called catarrh in this part of the world. What causes this condition? Is it a virus, is it bacteria, or is it fungal in nature?
Yes. Now, if people are exposed, you can get contact, you can have a person-to-person contact, you can contact this infection within yourself, from handshake, hugging, touching infected surfaces, you can have an infection affecting the nasal cavity. And if it's due to the viral, you see the patient having some running nose, some, they may have some feeling unwell, discomfort in the nose, some feverish feeling, all these conditions takes some few days, few weeks, it clears. And some people, they are used to just taking some vitamin C, which comes to them, some anti-allergic drugs like Piriton, which actually subside because actually it's a viral thing and it's self-limiting. And if there's a secondary infection, bacterial infection affecting it, you can now linger more than the normal 2 weeks. And as I've said before at the introduction, infection from the nose can spread to another space. We call it sinus. And the person will keep on having features of sinusitis, sneezing, nasal obstruction, nasal discharge. They can have headache. You can go on like that until when they now see an ENT surgeon who will probably diagnose whether they have a form of infective process going on or allergy or some what they call vasomotor rhinitis. That the people that have blockage that due to that due to some condition like a cold condition or under the AC or under the fan.
Is this condition contagious?
Yes, it's contagious. Like if you are in the environment where somebody sneeze a lot, or when they sneeze, or whether there's the cold generally around the whole place, just like in school children when they are in school, you see a lot of them coming back to the home after some few days of starting school, having common cold, like running nose, sneezing, and discharge from the.
All right, Dr. Adekoye, how true is the fact that you cannot treat influenza with medication, that in less than 7 weeks you get relieved?
Usually, as I've said, most of these things, when it's due to the bacteria, to viral, most of the time, viral conditions are self-limiting. They on their own leave the system, after some few days. It's only some virus like HIV that's more destructive to the cells and bringing out more disease. But all these normal this influenza that you get, other common cold viruses, within a short time it leaves. It leaves the system within 7 days to at least maximum of 2 weeks. You get much better.
But in this part of the world, people don't even wait till that 7 days. Once it's out there, during the onset, people go to the pharmacy to get over-the-counter drugs.
Well, most of the time they use vitamin C. They use Piriton, and they use all those drugs like that. But that's not treat anything per se. The virus that they are having is self-limiting. It takes its time to leave the system. So what they need to do as well is just to take more of fluid, so that they can rehydrate themselves. They take more of fluids and be able to eat properly that period, and get less exposed to the environment where all these things can actually they can actually contact.
Are there health conditions that are associated with influenza?
When somebody have this exposure to flu, flu, and having running nose, feeling unwell, having nose blockage, sneezing, and a lot of people, they actually take it as being malaria. They take it as being malaria, and that's why the current teaching now is that before you treat malaria, you need to do a blood test to actually see that you have malaria parasite. So a lot of people with upper respiratory tract infection like rhinitis, sinusitis, tonsillitis, pharyngitis, they will think that it's malaria. See, that's why it's advisable that before you treat malaria at all, you need to do some blood tests to actually make a diagnosis of malaria. Even some people who are having HIV, who are exposed to HIV and having HIV for the first time, the symptom of HIV, most of the time, 80% of them have to present to the ENT clinic. They come with rhinitis and just something to mimic malaria. So if you have done malaria parasite and you are negative, it's not there, you have to now see an ENT surgeon who manage conditions in the upper airway, so for proper diagnosis and treatment.
Could it be deadly?
Yes. Like it can be deadly, if infection, if it keep on to persist, affecting the structures, like the sinuses, affecting the air, and infection trying to go down, because infection can descend, it can be going down, because we said, from the upper, it can go to the lower, airway. And
what is the role of vaccines in preventing influenza or flu?
Vaccines, well, in most cases, it prevents patients from coming down, with severe symptoms of the upper airway infection, usually due to the viral. In this environment, we don't usually have the vaccines to be able to, against the influenza and other viruses that's affecting the upper respiratory tract. But well, I think we'll be looking inward towards that again.
But is it effective?
Yeah. Vaccine is very, very effective. Very effective. It brings, it makes the symptoms, very mild when it comes to the patient. You can still have these symptoms, but it makes it very, very mild, when the patient is affected.
Dr. Adekoya, how best can you treat influenza?
As you have said, this is a viral condition. Most of the time, it's due to the virus, and we said that virus are self-limiting condition. When the patient should come down with this condition of having running nose, you have to sneeze, they're feeling unwell, feeling fatigue. What you can do is to take more of fluids, then have much of rest. The patient needs to rest a lot, and you need to, well, if the condition is not subsiding after about 2 weeks, we need to see an ENT surgeon to be able to diagnose properly and be able to treat. Like I've said, a lot of things mimic, this influenza, like malaria, HIV, and some other conditions like that.
Thank you so much, Dr. Adekoya, for sharing your expertise with us on how to treat influenza, popularly called catarrh.
Thank you for having me.
Well, it's still Sound Health on Lagos Television, and Dr. Vincent Adekoya, consultant ear, nose and throat surgeon with the Lagos State University Teaching Hospital, has been diagnosing influenza, a common upper respiratory tract infection. Like I said earlier, it's a series, and we'll bring you concluding part next week. Please stay with us. The program continues in a moment. This is where we say thank you on today's edition of Sound Health. Hope you've learned how to stay healthy during the raining season. For comments and inquiries, please send SMS to 0035826603 or follow us on social media at LTV Social. #Sound Health. A sound health is a sound mind. Make healthy living your choice.